Why does OCD feel so real, and why does it feel like it's not OCD at times?
Well, it's that happens with pretty much almost every type of OCD.
Every single time.
is that it doesn't always feel like OCD, and you know, it's I've had some patients where maybe almost all the time they understand, like, this is OCD, I know this is OCD, but yet, you know, it's still very difficult to not do a compulsion. They have obsessions, but that's one of the insidious things about OCD, is that it often doesn't feel like this is, you know, a product of my mind. It feels like this is kind of the reality of what's going on. And so other examples, you know, outside of orientation OCD could be, you know, even with, say, something like contamination fears, that, well, you know, there are germs that live on door handles, you know, so it's real, and maybe I should be doing something to avoid it.
So part of the treatment involves recognizing OCD thoughts versus real reality-based thoughts. So trying to get your type of OCD, getting like, what color is it? What shape is it? When can I identify it? So it can't trick me.
Yeah, and I think from what I've seen therapeutically, of course, the hardest piece is the two words that are the bane of every therapist existence, and those are "what if," right? And how OCD will always have one more "what if" question than we have answer for. So therefore, the goal of treatment is not to convince somebody that something is real or not real. It's about getting somebody to be okay with the doubt and not knowing 100%. And that's the way almost everybody lives in the world, is never having 100% about anything. Even as we said earlier, like about maybe gender identification or orientations or those types of things as well too. So
and also, oh, sorry, I was going to say, and uncertainty about what's going to happen in the future too.
Yeah,